Here we go. It's
Hello, sailor boy.
there you go.
Festus is currently in San Diego in Independent Duty Corpsman School. It's
Independent duty.
corpsman. Corpsmen are medics.
All right. Okay.
Independent duty corpsmen are medics that are assigned to. So, like on the big aircraft carriers, they have full hospitals with doctors and surgeons and everything. But on the smaller ships, they have an independent duty corpsman who does all of the medical care, whatever the sailors need. And it's everything. It's
Well, it's not, up to a point, I would assume. You say, we're going to have to send you to the aircraft carrier. I can't handle this.
yeah. Part of what he has to learn how to do is to discern: is this something I can handle?
It's triage is what that's called,
Yeah.
Gina.
Because it's a big deal to have somebody. They have to be airlifted off with a helicopter. It's
Yeah.
usually a big deal. So the more things that he's able to handle on the ship, the better.
Yeah, I can sew that up.
Speaking of sewing it up, I told you about the training mission he had where a guy came to the clinic and he had, you're not supposed to have nipple rings.
No.
Remember this story?
Yes. Yeah, a guy got
his nipple ring caught in something and it ripped his nipple off. He had to
which is why you're not supposed to have
exactly
nipple rings.
This is precisely why.
Dumbass.
So I called him yesterday because I'd seen some news stories that were saying that the fires in L.A., part of what they do to help manage those is they'll turn the power off. Now, why do they turn the power off? Because sometimes that can spark new fires. They were talking about turning the power off all the way down to San Diego. So I was curious if his power was out, and so I called him to check on him. They hadn't turned the power off yet, and I don't think they ever did. But I said, "So what'd you learn in school today?" And he said, "It was Syphilis Day."
Yay, syphilis!
Syphilis Day.
I said, "Really? He's like, Mom, it's the Navy. Of course we need to learn about syphilis.
It's true.
You go into port and
Now, wait a minute. Come on. I mean, I can understand scurvy day, but
you go into port and you go have a little fun.
Yeah.
And you come back on the ship.
and you got a dose.
And I said, so what did you learn about syphilis? I said, how do you diagnose it? And I said, did they just say it hurts when I pee and they come to the clinic? He said, well, that's part of it. But he said they also will have a rash on their hands. So check your hands.
Yeah, kind of like this.
And on their feet. And he said, and we had to learn how to do a blood test to accurately diagnose.
I think one of the insidious things about syphilis is like the symptoms will disappear, and it'll be there, and you won't know it for years.
Yeah, it just lays in wait.
And then you can go blind, right?
It doesn't wait. I mean, it's just still working on you. You just don't know it.
Oh, I just looked it up. It's called latent syphilis. The infection is present in the body but doesn't cause symptoms that can last for years or decades.
Yeah.
So he has to be able to identify syphilis.
Well, the best way to identify it is like catch it, and just you need some
experience,
some first-hand experience with it.
But and it's very curable, by the way, if you have antibiotics, I guess.
Yep. It used to be penicillin is what but I think it's more antibiotics now.
But I'm just you think of a medic in the military, it's all like
ask him
sewing up gunshot wounds, but no, it's also sewing on nipples and checking for syphilis.
Ask him if they told him about the Sif shuffle.
Syphilis shuffle.
Oh, that's another way you identify.
That's like long term.
Those are guys who have gone.
Yeah. That's old Navy guys.
Well, it's spread to the brain and your nervous system, and
you kind of just sort of shuffle your feet, and like zombies.
Yeah.
But haven't you seen those old World War II posters?
STDs?
Shore leave. She could have syphilis. I know she looks like a nice girl.
She looks like a nice girl.
Yeah, and they always point to the girls.
Yeah.
The guys have it too.
She's a carrier.
use a condom, please.
Ugh.
So yeah, it's exciting stuff.
Well, is he enjoying that?
He loves it.
Hmm.
He said I'm learning stuff that it's different when you're going to school and it's stuff I want this information. Like you're not like, ugh, I got to study. And he's like, no, I want to know this stuff.
The chat room just found a syphilis poster from those days.
Yeah.
It's got a train, and all of these servicemen are getting off of it.
Mm-hmm.
It said, syphilis. All of these men have it. Women, stay away from dance halls.
That's horrible. So that's a warning for women. That's the other side
yes.
of it. That's
She may be a bag of trouble. Syphilis, gonorrhea.
She may be a bag of trouble. Now she looks disreputable.
you can
though.
tell she's got it. You can just tell looking at her.
Juke joint sniper, syphilis and gonorrhea.
Yes.
Yeah, she's standing out in front of Shorty's place. So
Well, Shorty's place. That's all you had to say to me.
Syphilis.
Yeah.
We interrupt this program to give you a bulletin just received from one of our naval units at sea.
That's right.
Hello, sailor boy.
There you go.
And he's doing great, by the way.
Good.